Hi everyone, and welcome to the second episode of the Henry Schein series focused on the COVID-19 crisis and dentistry. I'm Dr. Gary Severance with Henry Schein, and it's my pleasure to welcome you to this series. Now, last week we had an incredible turnout. Thank you all for attending, sending in questions. We had thousands view, hundreds of comments and feedback. We want to make sure we incorporate all your thoughts or give you the answers that you need. We also remind you that we have this resource page from Henry Schein, henryschein.com/COVID-19 update. This will be a resource where we put these videos as well as questions and answers and tips and tricks on communicating to patients, closing down your office and otherwise. So hope you'll use that resource. In this episode, we're going to focus on dentistry not only as maybe the greatest profession, but also as your primary business. We're going to take a clinical and a business look at it. First, we'll connect with Dr. Reznik from the clinical side, and then welcome in Mark Rosen, who will give us some insight into what we should be doing from a business perspective. Joining us each week to give us an update is Dr. Reznik. He's the Director of Oral Health Center of Grady's Infectious Disease Program and a practicing clinician. And he'll respond to some of the questions that we got, but also update us on what's new. Welcome again, Dr. Reznik.
Thank you, Gary, and thanks for having me back to talk about this new pandemic that we've been dealing with on a regular basis now, and how it's impacting our lives and how we can safely perform the emergency procedures that we are bound to do. I put together a bit of a word cloud for you just to show you some of the repeat of some of the things that I talked about last week, some of the symptoms such as recent onset diarrhea, some of the other things including dry cough, fever, recent onset aches and pains. So there's certain things that we really look for: shortness of breath, tightness in the chest, and the importance of things such as standard precautions, hand hygiene, washing your hands for 20 seconds, wearing the appropriate kinds of face shields and PPE when managing people who we suspect might have coronavirus, or people who we are just taking extra precautions during this different challenge for dentistry. The role of the dental team has always been important. And one of the things that we're doing as frontline healthcare workers is honestly managing dental emergencies. Emergency departments are overrun. And before we had COVID-19, there were a great deal of non-traumatic dental emergencies showing up at emergency rooms throughout the country, including mine at Grady Hospital. So we are frontline healthcare workers. We do our best to keep people out of emergency rooms and to address pain and infection. But when we do this, we have to actually take our standard precautions a little bit further. Now we really want to make sure that our waiting rooms have been wiped down several times, our desks, our door handles, any area that a patient might come in contact, making sure that we might have hand sanitizer available. And when we're using our disinfecting products, please follow the manufacturer's directions for use. Just because you wipe something, it has to stay wet for a certain period of time. So look at your disinfectant and make sure that you follow the manufacturer's use and that we're following the appropriate amount of time. As far as we go with asymptomatic patients, we want to put everything in place that we've always done for bloodborne pathogens. So our standard precautions, those are very, very important. And we also have to realize that a lot of people that we may come in contact might be asymptomatic. The Diamond Princess, that ill-fated cruise ship, literally had traces of COVID-19 17 days after the ship was emptied. And this is according to the U.S. Center for Disease Control. Of course, this was prior to the ship being disinfected. Of interest is also that 18% of the infected ship members did not show symptoms. So just like when we see a patient and we assume they have an infectious bloodborne pathogen, hence why we put standard precautions in place, when we see an emergency patient, we have to assume that they possibly have COVID-19, and we're doing standard precautions. And if we must use an aerosolized generating procedure, So anything that involves a high-speed handpiece, anything that would involve using a high-speed ultrasonic scaler, always use an N95 respirator. And it's very important that we take care of our N95 respirators as frontline healthcare workers because there is a shortage throughout the country and we need to preserve them. So there are different ways that we can preserve them. One would be wearing a face shield over it. That way, if it gets, because once an N95 becomes wet, it's no longer good. N95s must stay dry. So you might have heard last time I said if you do put on an N95 and you're wearing a different kind of shield, you might want to put a different mask over it just so it doesn't get wet. And once an N95 gets wet, as I said, it's no longer of use. I have a slide up here just showing you how to put it on correctly. Working in healthcare for several decades, you see people walking around with N95s on backwards or masks on backwards or not covering the nose or on their chin or on their forehead. Please make sure that you follow the directions here. We want it tight fit because what we do at the hospital is we literally get fit tested for our N95s. And although that sounds sort of fancy, basically what we're doing is putting on an N95. We're in basically a little bit of a tent and they spray something into the tent that has an odor. And if we can smell it, we know it's not fit tested. So there's different ways of doing that. But right now, we just want to make sure that you have an N95 on if you're doing aerosolized generating procedures and that you put it on correctly. The CDC has a list of N95 particulate filtering face pieces, and I included the link here so you can look at the different kinds that are out there and that are available. I do want to say I work a lot with our ENT colleagues. That's sort of since we deal with some oral cancer in the program that I work with, and ENT has always been a great group of folks to work with, especially Dr. Charles Moore, who is chief of the service at the hospital. And when talking to Charles, he basically gave some information on what was happening in China during performing some ENT surgeries and how the risk was actually going up. So for ENT, they're using powered air purifying respirators, and you can see that. There is no call for this yet in dentistry. Right now, our PPE plus an N95 respirator, if generating an aerosol, should be sufficient and should be what we are using. Another issue that has come up is the use of ibuprofen. Can we use ibuprofen? One of the issues that dentistry has really made a marked improvement on is reducing the number of opioid-containing pain medications post-op. And ibuprofen plus Tylenol has proved to be one of our best weapons to address pain, and we don't want our patients to be in pain. So there was a rumor that came out from France that basically said it could activate COVID-19 or make COVID-19 worse. And so the European Medicines Agency released a statement saying that they're monitoring the situation, but currently there is no scientific evidence that establishing a link between ibuprofen and worsening of COVID-19. Another colleague of mine, Dr. Carlos Del Rio, a professor of infectious disease and global health at Emory University's Department of Medicine, actually agrees. He thought the Minister of Health of France was wrong in prohibiting the use of ibuprofen based on limited data. So you are going to hear things that come out pretty quickly. Please check back to make sure that we're operating on evidence-based information and on the truth. So basically, on currently available information, the World Health Organization doesn't recommend against the use of ibuprofen. So right now, ibuprofen is one of our main tools to control pain for this patient population. Other questions that have come up involve clothing. And what do we do about clothing? Are we taking home the virus? And so what I do and what is being recommended to do is that when I get home in the basement, I take off my scrubs and put them directly into the washing machine. I also take off my shoes before entering the house. And then I go up in the shower and I take a quick shower just to make sure I'm not bringing any to do home because protecting my family, like you would want to protect your family, is my main priority. So I did want to share that information with you as well. I'm going to turn it back to Gary now, and please don't hesitate to send in your questions and your comments, and we'll address them in upcoming episodes. Thanks so much for your time, and here you go, Gary.
Thank you so much, Dr. Reznik, for your contribution this week as well. It's always good to get the most up-to-date information that we have to our entire dental profession for our safety as well as our patients, but also addressing some of the questions or concerns we had from last week. So thank you again. We look forward to your continuing contribution. We want to now turn to the business side of dentistry, and joining us is Mark Rosen. Mark is a partner in Rosen and Associates, an accounting firm that is specialized in the dental profession. Mark, thank you very much for joining and bringing your expertise and guidance to our audience.
Thanks, Gary, for the introduction. Really appreciate it. Glad to be here. Lots going on, obviously. But first of all, I'm Mark Rosen, partner at Rosen and Associates. Work with about 800 dental practices throughout New England. We're in it right now to help everybody out. So hopefully we'll go through this session and talk about some action plans for your office and also the new CARES Act that was just passed on Thursday night by the Senate, not yet by the House at the time of this filming, but we'll go through some of the main topics and hopefully very educational for everybody to get everybody started on the right foot. All right, so let's get right into it. So first of all, this is unprecedented times, obviously. The environment, the landscape changing faster than I can answer emails, texts, or phone calls. And so, we're trying our best here to stay on top of everything. And right now, we're hoping to give some tips on what you want to do with your practice right now. And then given the state of the environment, just on Wednesday night, very, very early in the morning, it was the Senate passed the CARES Act. And with that, we got a lot of information, and I'm hoping to display some highlights of it later in the presentation here. But we're going to start with some action plans of what you should be doing right now, because the bill isn't passed yet, still has to go through the House. So let's talk about some action plans first, and then we'll go into that. So for starters, lots of conversations about loans out there, and there are all types of loans right now that are available. One of the big popular ones right now, clearly, is the SBA loan, the disaster relief loan. So if you haven't looked into that, it may be something to do. Now, first of all, each different practice is different. Not necessarily everyone should go out and get it. It may not be the best option for you. There are state options that can be given too. I know Massachusetts has one. I know Connecticut's got one, and I'm sure other states around the country also have them. So you want to look into those. But the other place to obviously reach out to are dental-specific lenders like Henry Schein. So they're going to be talking later on, and Gary's going to mention later on some different options that Henry Schein Finance can help with. But reaching out to your local bank too, and then you'd be surprised at dental insurance companies. Very recently, some dental insurance companies have begun to give some loans in which they can get repaid through future collections. So definitely something to keep your eyes open for. Look out for the emails. Not that you're not getting enough already. I'm sure there are lots coming through, but getting a loan at this time period is important. I'm going to touch on a loan in the CARES Act when we get there. Something new that's been presented, so we'll get there in a little bit. Now, let's take a look at the practice. Now, you clearly have loans most likely from prior equipment purchases or buying the practice. So if you haven't done so already, you want to reach out to your banker and your lender. But one of the things you got to be aware of is most of these banks require you to have auto pay come out. And so I know some of them are going through their list and trying to take you off auto pay, but you really want to reach out to your bank and make sure that is in fact turned off. I have no idea what the lead time is for them to turn it off. My guess is a couple days. So you really want to be careful and make sure that is in fact turned off. Otherwise, it's going to come out, and you probably won't be very happy at this point. So definitely do that. In the same sense, let's talk about the credit card company. So any credit card you may have, whatever it may be, I would definitely call them and see what kind of terms they're offering, because you obviously owe the money at some point. But, I happened to call a credit card company, my credit card company, and they said they were going to do zero minimum payment for 0% for a month. and then they wanted me to call back in a month or so. So that's totally fine. Now I can pause my payment. I can look at what other things I need to pay. I can take my time a little bit to do that. You just need to be a little careful that if you do pause your payment and don't make it, and you do have to spend money on something, that you're not hitting your credit limit. So you need to be a little careful there, but reaching out to your credit card company, and again, if you have that on auto pay where it just hits automatically, you want to make sure that you turn that off so you can just pay, whatever you're able to, what you have available. So another good action plan, obviously, is contacting your landlord, supply company, labs, some of your large expenditures, and working with them. Now, the goal isn't to never pay them. You're obviously going to pay them. It's just a matter of, what you want to do over time. And so, just like some of the banks are doing, in which case they're, deferring some payments for 3 months or maybe even 6 months, they're just tacking it on to the end of the loan. So you're going to pay the same thing. They're just pushing it out. In the same sense, your landlord might be willing to do the same thing. They may be willing to reduce your rent payment now and then either tack it on, maybe not at the end because of the term of a specific lease, but you may be able to just put it into payments and increase future payments by a certain amount. Again, just to get to the point where you get going again, collections have kicked in. So working out the payment plans there, hopefully, they're able to be flexible. So talking to your insurance broker is one other thing, and that kind of goes into your employees and what's going on with them. But speaking with them about, making sure when your next payment's going to hit. Maybe there's a little bit of delay, but health insurance is really something you got to be really careful with. The last thing you want, especially given everything that's going on, is to stop your employee's health insurance by mistake and not realize if someone has to go to the doctor that their insurance is lapsed. So got to be careful there. So if you are an S corporation, okay, that means you can be an employee of the business. And if you're an employee and you own it, you may want to stop your payroll. Why? Well, for now, I'll just say you can not pay your Social Security and Medicare for the moment. And we're going to talk about different programs they have to help with that. But if you didn't take pay that way and you took it through a distribution right now, just a draw, you can make up the payroll or the 401k withdrawal later on. But for the moment, it saves Social Security and Medicare, puts it on pause essentially till later on when you need to take a pay or adjust your payroll for the end of the year for something. So as we move on here, during these tough times, there's really specific people you want to be able to reach out to. And your office manager is going to be one of those people for sure. So you pick the office manager, you pick your accounting team, your legal team for reasons. So those are the people you want to lean on. You want to make sure that you are in constant contact with them in order to help provide any advice that you can. They obviously know your practice best along with yourself. So having that office manager on board, that key employee, maybe it's the head hygienist. We'll talk about employees, but if they are working, we have to pay them. So we got to keep an eye on that. But keeping your team intact is really important. So another thing that most people I think haven't thought of, right? We've been so engrossed in everything that's going on and the information that's coming out, and how do we keep up with it, and how does it affect our practice, and what do we do? But there are still, if you step back and you look at your practice, there are probably lots of outstanding insurance claims that haven't been collected yet. Or maybe your front desk may not have done them right to begin with. So to have an employee do it right now, well, then you need to pay them. So if you are paying them and you've kept them on payroll, then great. They should be going through those insurance claims. They should be looking and seeing what hasn't been filed, looking, making sure that you're getting every single penny that you're supposed to. However, there are outsourcing companies out there that you can hire, and you're only going to pay them if they collect money. So if you have furloughed your employees or terminated them, if you've done that and you currently don't have employees for the very moment, looking into something like that may be a huge option. Picking up those outstanding claims that you may not even know that are there, could bring in some extra found money that you may never have had the time to go back and look at it. So, reviewing your numbers, unfortunately, as you're closed, you have some time, right? So looking at your numbers, what does your production look like beforehand? What do we need to get back to? What were your monthly collections in the past? What were your weekly collections if you can break things down that far? Trying to look at really piece by piece. So when you do open back up, you know what to expect. You know maybe that your front desk, the systems in your front desk are better. You've looked at the reports, you've looked at the accounts receivable. You really take the time to do that because right now it's a good time to do that. Unfortunately, as we're closed, but there's not a lot of time usually that you are able to go through the claims or review the numbers. So I think it's a great chance to do that. So one thing that's always been a pet peeve of mine in any type of webinar or speech I give, I have three main pet peeves, and I won't really go into them, but one of them is don't do your own payroll. And it is not any more important than now. Now is probably the most important to not do your own payroll, to really get a payroll company, because some of these credits, and I'll talk about them in a minute, but some of the way that the government is reimbursing you are through your payroll. A lot of them are through your payroll, right? Because they want it to keep going. So how those credits go onto your quarterly tax return, that 941 that you file, or what you can do is huge. I always say you don't want to mess up paying your employees, and you don't. But you also don't want to mess up the credit, which may give you money back in your pocket. And because of that, we are now at, we're at March 26th right now. We'll get this. You'll see it on March 27th, and the quarter will end very shortly. So you want the quarter to end, and typically starting payroll up at the beginning of a quarter is the way to go. And you're right on the cusp right here. So April 1st is going to come fairly quickly. So locking into a payroll company is great. So you really want to figure that out so you can get the most out of anything that the government is providing. So lots of questions on employees as we look at unemployment. Now, I am not an unemployment lawyer. I've learned a lot about unemployment over the last week or so, more than I ever thought I would know. And so lots of questions around furlough or leave of absence or termination. So first, let's just talk about the difference there. So when you furlough an employee or leave of absence, it's essentially the same thing. You have retained them as an employee. So they're still technically an employee, but you've reduced your hours so much that they don't have any work to do, right? So therefore, they can claim unemployment, but they are still employees, okay? Now, if you terminate someone, when you terminate them, they are off your books completely. However, again, I'm not an employment lawyer, but you need to make sure your vacation time is paid up, they've been given their last paycheck at the right time. You need to go through certain steps to make sure that you're terminating them correctly. So if that was not done and they just filed for termination, you just said to everybody, hey, I'm terminating you without any formal letter, you really want to speak to an HR person or maybe an employment lawyer to find out, hey, this is the way I did it. I may need to go backwards and fix it to make sure I'm doing it properly. So you really want to look into that. Now, the government is clearly doing as best a job as they can to have you not do that, which lots of people have. But in the CARES Act, there are some things that if you have employees still, or if you rehire them, we'll touch on that. So the way the government's helping are really through payroll tax credits can be available. And that's really what I want to say. So, beginning April 1st, and that's the key. Originally, it was thought that April 2nd would have been the date, but from the newest materials that I've read, April 1st is really when this begins, when they start to look at the payroll tax credit, or when the Families First Coronavirus Response Act kicks in. So lots of talk about paid sick leave and emergency family and medical leave. There's some great articles out there and lots of detail on everything. But one of the big questions were, number one, were dentists included in that? And so far have not seen anything that is excluding you. So right now I would say yes, would be my opinion. Again, we're still waiting on more guidance though from the Department of Labor. They're the ones that are going to really define some of this. Very interesting how the political system works there. But one of the things in the language it did say was that if you had less than 50 employees and there would be a going concern to your business by shutting down. So a growing concern is, what you really want to look at there is if going forward is going to impact your business and you don't have the cash to be able to do it, then you may be able to fit into that, you may be able to fit under the bucket, under that definition that they're talking about. So the Department of Labor waiting to define exactly who will fit that in. So for example, if you've got a practice that has $1 million in the bank, you can cover payroll. Assuming you're under 50 employees, you're a dental office, you can most likely cover payroll for a month, 2, 3. You have plenty of cash to do it. You probably aren't a concern going forward, or maybe defined as one. But if you've got $20,000 in the bank and your payroll is 15, you can't go too far. So then you may fit into that. So it's a little up in the air right now. So right now, we're not positive if you're included or not yet. We're still waiting on that Department of Labor. And unfortunately, sort of that's the life we're living in. It's in real time. It's going super fast. Landscape's changing faster than anyone can keep up. And so the guidance doesn't quite come out as fast as some of the rules do. All right, on to more fun topics here on the tax deadlines. So I'm sure many people have heard by now, April 15th was going to come pretty quickly, but now it's moving to July 15th. So that's probably one of the bigger news out there is that the April 15th deadline moved to July 15th. So what that does is it takes our first quarter and puts it to July, first quarter estimates, if you pay estimates, to July 15th also. But I've been asked some questions about, well, what about the second quarter? Because the second quarter estimate is typically done June 15th. So at this very moment, we believe that it hasn't moved yet, which seems a little odd that the second quarter would be before the first quarter. But so we're waiting for more guidance on that, of how that would work. But most likely it would get pushed. But as of this very minute, technically it's still on June 15th. So, but your first quarter estimate and the payment due is all pushed to July 15th. So other deadlines that are typically April 15th that got moved are the IRA contribution. If you're going to make an IRA contribution before the tax filing deadline, that's on July 15th. And I believe so is the HSA contribution. I had read that too. So that normally needs to be done. And that is for the 2019 year. Okay, you can make that contribution in 2020, but now you have until July 15th to make that contribution. So the federal has moved, but some of the states are following suit and others are not. So you definitely check in with your state deadline and see when they're due. More likely than not, if you're planning to do everything for July 15th federally, you would just need to put the state on extension and then, take it to July 15th too. But if your state doesn't move, you may need to run tax calculations, or your accountant may need to run tax calculations to see, what may need to be paid for the extension deadline if in fact they don't follow along the federal. Hopefully they all do, but you just never know. Unfortunately, in prior years, people have been unable to pay all of their taxes at different times. So they're on an installment agreement with the IRS. But for right now, the installment agreements have actually been pushed back. And so if you have an auto pay, then you may want to try to get that shut off. But if you are writing a check right now, the installment agreement is getting pushed off, I believe, until July 15th. However, come July 15th, you should make that payment. Otherwise, that installment agreement will get kicked out. So if you're on a prior year installment agreement with the IRS, you do have a 3-month reprieve from paying it, or up to July 15th. But if your payment is normally taken on July 20th or paid on July 20th, then you need to make sure that that's paid on time. Otherwise, future installment agreements, it will get kicked out. And therefore, your money due, whatever remaining balance you have, will become due immediately. So you got to be really careful of that. So the big news, obviously, was the CARES Act. And the information came in fast and furious, very early, about 1:30 in the morning or something. It got passed by the Senate. And so at the time of the filming of this right now, and the House has not passed the bill, although I believe it passed with unanimously in the Senate, so it should go through, but we obviously don't know. So I'm going to preface that with these are the highlights of the Senate passed bill, and we need to wait a little bit to see what the House is going to do, if anything. Hopefully they don't make any changes, and these are there. But so here's some highlights. All right, so this may be one of the bigger ones that's really important, and we talked about loans a little earlier. So there's this section called payroll protection loan. Okay, now it's going to be done through the local bank, from our understanding, but backed by the SBA. But the banks at this stage don't know how this works. Nobody knows how this works. I've been in contact with some banks already, and they're not sure how they get the money from the SBA. That's the banks, that is. But if you want to call your banker and get in line, it never can hurt. I'm sure they'll love this as they continue to get calls, but letting them know that you want to potentially do this. And let's talk about what it is. So you need to have less than 500 employees. And if you get in quick enough, okay, and it's the first bunch of people, I don't know how many people, there's only a certain amount of money that can get the advance, the $10,000 advance, which the SBA says will be funded in about 3 days. Again, how the process works through the local bank, we're still waiting on guidance on. So just giving you a heads up as to what's coming down a little bit, what's coming down in the next day or two. So the loan would be for about 2.5 months worth of payroll. All right. Now, there's how you calculate it and everything, and it would include pay for your health insurance and for retirement, everything relating to the employees. Now, here's the thing. If you don't have employees right now, meaning you have terminated them all, then you're not going to qualify for the loan. That's what I imagine. So now you got to look at is, do I want to rehire them and take them off unemployment? And that may be something to do. Because at the end of the day here, if the government's going to give you money to pay for your payroll, okay, they're going to give you money to pay for your payroll, then if we can help those employees out and give them the same pay they were making before, and then if you do make that payment, okay, I'm sorry, if you do borrow the money, they say right now it's a 10-year loan, 4% interest. But it's got to cover these certain things, payroll, rent, utilities. And you don't have to do a guarantee, which is great. Okay, you probably have enough personal guarantees out there already. But the key is the forgiveness piece. And this is the stuff that's been thrown around there, is how do we get this money? And I heard it's going to be free. So the way they're doing it, at least it reads right now the way they're doing it, is that you take this money from them, you borrow this money. Let's just say it's $50,000, which is 2.5 months of payroll. And they'll lend that to you. As long as you use it for the items that they want it used for, and then you can prove that later on, then they say it will be forgiven. Okay, so as I keep going here, we'll look at how the reduction of it. So if you get the money, okay, so reduce them for the company reduces its workforce. So what that means is if I hired everyone, if I'm going to qualify for the loan, I believe, and I bring everyone in, but then I start to lay people off, then I don't get as much forgiveness. So the goal there is they're hoping to give you money in order to pay your payroll, keep up with the fringe benefits and for the staff, medical, health insurance, retirement. And then as long as you do that during those 2.5 months, then they will forgive that loan. If you don't use it for that, or you don't have employees or you lay employees off, they say then it kicks into actually being a loan. So how you apply for it exactly, it's going to be through your local banks. I think a lot of banks, if not all banks, are going to be participating, but I've only so far seen a handful that I know are, but I'm not sure exactly who yet, and they don't exactly know how the program works. So again, the landscape's changing every hour, but that is something that you may want to look at. So if we step back, employees might be on unemployment right now. You may want to look into rehiring them back if you're able to get that loan. If they are hired back, I'm assuming you can have them do work because you're paying for them to do something. You really want to have them do something, whether it's, again, researching the claims, whether it's doing CE classes, something. And then if it goes beyond a certain time, which hopefully this doesn't, clearly, then maybe they go back on unemployment. So maybe it's a tiered process. But again, continue to see how it goes and what needs to be done and take it step by step as we get more guidance. So the other big thing in the news is the stimulus checks. So the stimulus checks are $1,200 per person or $2,400 married filing jointly. Okay, married jointly filing there. The phase out begins at around $75,000 for a single. But if you make more, and I say make, not gross income, but taxable income, If you're single, more than 99,000, or married filing jointly, 198,000. Bottom line, if your taxable income, married filing jointly, is over $200,000, you will not get a check in the mail. Now, these checks aren't really free money. I don't detail it out here, and more information will come. But if you do get it, it's really something that potentially could get paid back. Okay, potentially get paid back through taxes in the future on your 2020 tax return. Looking at that, so they're going to advance you money now, looking at either your 2018 return or your 19 return if it's been filed, and then as you begin to do future tax returns, it could potentially get paid back depending on your income level. So maybe you had a really low year, but typically you make a lot more money. That may be something where you get the money now and you may have to return it through a tax in the future. So retirement, if you are of the age where you need to take required minimum distributions, which is now 72, but in the past was 70 and a half, you don't have to take those RMDs in 2020. So you can suspend them for a year. So letting you keep your money there. But if you do have money in the IRA and you are able to take $100,000, typically it would have been a 10% penalty if you're below 59 and a half. But you can take it out penalty free, and then you pay the tax over 3 years instead of 1 year. So normally you take the money out, penalize 10%, pay the tax in the year of withdrawal. Now they're saying no penalty on it, so no 10% penalty, taxed over a 3-year period. However, there's always been a rule, or recent years, that you can, if you did take out money, you could put it back in within 60 days with no issue. And they're saying you can do that, but you have 3 years to put it in. I'm not quite sure yet. Maybe an amended return, if you took out the money now and had to pay tax 1 year, tax the next, and then you put all the money back in, you may have to go backwards and amend your returns to get out of that tax that you had paid in because you've replenished everything you took. So again, don't know all the rules on that, but that gives you a little bit of a guideline. So this is something interesting I thought they put in there, and it's really, again, to incentivize the employers to help out the employees. There's always been a small rule out there where you can help pay tuition payments for some employees, whether CE credits, if you really think of it that way, but some type of tuition. But now, as a perk to the employees, instead of paying them, if you will, you can give an employee $5,250 in their student loan repayment, which is going to be a great tool actually for the year. I assume this ends by the end of the year. I don't know that for a fact. I don't think I've read how long they're going to keep that going for. So when the everything kind of finalizes and we get some guidelines, there may be more on that. But obviously all the dental students, lots of them, even dental owners, of course, still have student loan payments. So my assumption is you write the check and it becomes a deduction to the practice. And then if you're paying the employee, it becomes a fringe benefit, not taxable to them, just like medical insurance is not taxable to them, the portion that you pay. So that's one way, to help out the employee so they can, help reduce those student loan payments, which right now, from a federal standpoint, the federal student loans have actually been pushed back a couple months. So if you have a federal student loan, you want to get into more research on that. That's been pushed back a little bit. But so that's one way to help out the employee. Now, payroll tax deferral here is one of the last pieces I'm going to touch on, and there's tons and tons in this bill and in the CARES Act, and we've gone through it, as best we can right now, trying to highlight things. But this is pretty interesting. So once between now and the end of the year, okay, the way payroll taxes work, if you don't know it, is when you pay an employee, a portion of that payment is an employee tax, and then you, as the employer, match that, right? 7.65% up to 132,000 or so is taken out of taken out of the employee's pay as the employee side. The employer matches that. Okay, so what the government's saying is the match piece that the employer would typically pay, that you get to hold on to that money. Okay, you hold on to that money till the end of the year. Okay, that's 7.65%, essentially of all your payroll. Let's ignore a high earning associate. Okay, everyone makes below 130 grand. Let's say 7.65% of the payroll which you would typically pay out to the government, you get to keep in your pocket, use as cash flow, as working capital until the end of the year. And then during 2021, you have to pay back 50% of it. And then 2022, you pay back the rest. So this sort of goes back to the, how do I do this if I do my own payroll? And my answer is, don't do your own payroll, because this is going to start to, you want to make sure that you're not paying in what you don't need to pay in, keeping the right cash. And I'm sure this will be scrutinized to make sure the government is getting their money somewhere along the way. So, hopefully everything I went over today is beneficial. Action plans for the office of what you can do outside of the laws. Now, taking the new laws into consideration a little bit. The CARES Act is moving a ton. So, but one of the places that you can really go is a group called the Academy of Dental CPAs. So we are one of the founding members of the ADCPA, and you can get there by adcpa.org. And there are dental accountants all over the country in your different states and areas that can help, are going over this piece by piece. We have phone calls often. We have lots of emails going around to help interpret it, find out the best way that it can help you. So hopefully it's been beneficial. Thank you, the Henry Schein team, for having me on, and back to you guys.
Thank you, Mark, for that detailed information. Also, we look forward to an update on the CARES Act and what it really specifically means when it goes through the House for dental professionals and how we can maximize those benefits. One thing Henry Schein Financial has done is set up a hotline and an email where you can get information on working with your current loans, getting deferrals and restructuring that's available. They can get working capital on loans from $50,000 to $150,000 and get you those loans as quickly as within 3 days. They'll also look at bridge loans, deferred and graduated payment programs that's available to help ease everyone's cash flow and concerns. Now, dentistry is at a turning point, obviously, something we've never experienced before. Our whole lives are. And what I've taken time doing in my off hours of working at home is to go through and go back through some of the TED Talks. I've found that over nearly 20 years, they've been able to address crises with unique solutions and things we haven't heard of. So watching one of my favorite ones by Brian Stevenson, an attorney talking about social injustice, a line popped out, or a couple lines popped out, in a theme that I think applies maybe to all of us. He was talking about creating your own identity, making yourselves unique and valuable. He was talking about the teaching profession, but also the medical profession and dental profession when he said, if you're a doctor, you can do some things, but if you're a caring doctor, you can do some other things. And he kept talking about care, compassion, and communication. Now, the fact is most dental offices are either closed or limited to emergency patients at this time. But it's the vital importance to really continue the communication with your patients. Show them that you're compassionate, that you're caring, which you are, and a trusted healthcare professional. You have communicated to your patients probably that your reduced hours or your change or what's going on, either by changing your website, sending emails out, or social media. But you can be a vital advisor to them all as a healthcare professional in how to survive this pandemic. Just think if every dental professional reached out to their patient base. We have about 200,000 dentists in North America, each with about 1,000 patients on average. We could touch 200 million patients and provide them the right information. Make sure that they understand that they trust you and you trust them. And you want to filter through all the misinformation and give it right. Don't ever underestimate the trust your patients have in you and your team. Utilize that now and communicate with them. Fortunately, on our resource page, we also have some tools of communicating to your patient base during this time. So use those if you need a template or a key. Thank you again for attending this session this week. We hope you continue to watch. We hope you share this with all dental professionals. And most importantly, we hope you respond with comments or questions that you want. You are truly our audience, and you are truly the architects of our series. How can we fulfill your needs? How can we answer your questions? Have topics that you'd like us to cover in next week's webinar on COVID-19 and dentistry? Email to webinars@henryschein.com And certainly we've used YouTube now for our processing and presenting, so please subscribe to the Henry Schein YouTube page just below, and you'll continue to get the most recent updates on these and other videos and webinars. Now, for more information and a full list of all references, please visit the Henry Schein COVID-19 Resource Center, www.henryschein.com/COVID-19 update. Thank you again for attending. Until next week, stay safe and stay informed.